The programme for government has pledged, Minister, to introduce a statutory scheme to support people to live in their own homes, providing equitable access to high-quality regulated home care. This commitment is crucial, particularly for our elderly population, who often prefer to age in the comfort of their own home. The Department of Health is responsible for developing the regulatory framework for home support services providers. Their goal is to ensure that all services users receive regulated care. The Department is currently working across 4 broad areas to fulfil this commitment: regulation of home support providers, collaboration with the HSE to develop a reformed model of service delivery for home support, implementation of the recommendations of the Strategic Workforce Advisory Group. However, the Minister for Health recent home care bill, the Health Bill 2024, has been met with frustration and disappointment. The bill focuses solely on the regulation of home care service providers and fails to address access to service or affordability. This falls significantly short of the promises made in the Statutory and the expectations set in the programme for government. The programme of government had promised a statutory home care scheme as part of the government's commitment to fair and affordable health care. This promise was made alongside pledges to introduce GP cards, remove inpatient charges and reduce medicine costs. It was universally accepted in the Sláinte Care report that a statutory entitlement to home care and community care equivalent to the Fair Deal scheme for nursing home care is necessary. Yet, 7 years later, all the government has managed to produce is a limited and underwhelming licence scheme. This bill has become entirely about regulating a market of providers instead of providing a statutory right of access. The expectation was an improved version of the nursing home support schemes, which would deliver equitable access to home care. This is widely recognised as essential to reducing pressure on hospitals. The Sláinte Care report also recognises that in the absence of an entitlement to home care services, many people pay out of pocket for private home care services. This should be addressed by ending the over-reliance on market mechanism to deliver new healthcare services by the expansion of the public nursing homes and home care. However, the Health Bill 2024 does the opposite by designing the home care regulatory system around the private market, further embedding privatisation instead of resetting the balance within a genuinely public health system which is universal in access and free at the point of access. This government has failed to deliver meaningful home care reform to reduce hospital waiting lists, to expand medical care eligibility, or deliver an entitlement-based system of care. Fianna Fáil and Fine Gael and Greens have turned their backs on the core community and home care reform, which underpins Sláinte Care, if they ever believed in them in the first place. For example, in 2022 alone, nearly 3 million hours of home care promised by the HSE could not be provided, mainly due to a shortage of staff. This is a recurring theme where the HSE sets a target and then fails to meet that target in 2022. The target of 23.67 million hours of home care provided just 20.79 million. Despite over 6,000 people on waiting lists in the area of Cork and Kerry lost out on 144,797 hours, followed by the south and southwestern area of Dublin, as well as parts of Kildare and Wicklow. It comes as around 6,500, mostly older people, are on waiting lists, more than half of whom are seeking the service for the first time, with others in need of an additional support. In Cork alone, over 700 people are on the list. This situation highlights the urgent need for reform in the provision of home care services. The state's current approach is failing to meet the needs of our elderly population, who deserve to receive care in their own homes. It's time for the government to deliver on its promises and ensure that all citizens have access to care they need. And care comes in many ways when people are sick or when people are ill. And I would like to mention the critical issue of the pending funding for Cancer Connect in Cork County. This esteemed organisation has been instrumental in providing daily transport for individuals undergoing chemotherapy or radiotherapy across Cork County in a single month. in a single month of 2024, Cancer Connect facilitated over 730 journeys, Minister, underscoring the vital nature of the service. The operational funds for Cancer Connect have predominantly been sourced through local fundraising efforts. However, this method of financing is not viable long-term, and the state support is imperative for the continuation of this incredible service. Approximately 2 years, the chairman and manager of Cancer Connect met with Minister Micheál Martin in Taoiseach in Cork to discuss the necessity of substantial state funding, specifically an annual contribution of 100,000 was mentioned. A commitment to this effect was also made in the Dáil. Regrettably, as of June the 18th, Cancer Connect of this year, Cancer Connect has yet to receive any portion of the promised funding, despite numerous public assurances by government officials. I urge you to provide clarity, this Minister. If you can't, maybe you might pass it on to the Minister who can, on when Cancer Connect can expect to receive the pledged financial support, ensuring the sustainability of its essential service. I have contacted the Minister's office many times in relation to this, and I'm still awaiting clarity. And the funny thing is that it was openly publicised by a TD over a year and a half ago in West Cork that the money was there, and it was going to be, it was announced, and they were going to get it. Imagine Cancer Connect, the care that people need, they get it from their own families, and they need it. Obviously, when this Cancer Connect was set up, and I was involved in it initially, it probably was never expected to expand to where it has. It has expanded. Other counties now are trying to copy on running the service. People are picked up at the door. Some people are it's a one-to-one service. More can be picked up by bus, taken up for their chemotherapy, all organised above in COH and turned around and brought back down again within a few hours. But that service cannot continue without funding, and it has been promised funding. And why haven't they been given the funding? And Minister, it's slightly maybe different to the issue, but it's all to do with health. And I'd appreciate if you could intervene, or someone intervene, and give Cancer Connect their rightful, what they rightfully deserve here. This can't continue on voluntary contributions on the people of Cork County or West Cork. It has to get the slight state aid, 100,000, not a big lot to ask after, and it's in operation about 10 years, or not more.
Thank you very much, Deputy Collins.